Thank you, and welcome everyone. Thank you for taking time out of your weekend to be in connection with all of us and in unison during these very challenging times. My name is Nimesh, and I've been living and volunteering at Manav Sadhna for many years now, and have been deeply humbled by the amazing souls who are on the ground as we speak, and their spirit, energy, commitment, their commitment to serving with a lot of love and a lot of detail. Um, Our intention for this call today is to humbly share with you the work that's being done. And it's all being done because of all of your and many others' prayers, blessings, support. Um, it's a small intention to kind of bring together the flow of support full circle. Allows us to be more closer connected onto what is going on in the ground in India right now. We're not professionals in presentations, but rather have tried our best in a limited time to capture and share what is so close to heart and what so many of you have been deeply a part of, but physically don't have the chance to be there. So our team today from Manav Sadhna is here on behalf of a large team of 120 staff and volunteers and a larger global family that you are all a part of, working daily to help those in need. So I'll introduce very briefly. We have Ajay, who has been with Manav Sadhna for over 20 years now. Neelam, who has been serving over 12 years with Manav Sadhna. Vandana Didi, who has been a full-time volunteer and trustee for over 20 years. Anjali, who has been a full-time volunteer with Manav Sadhna for 20 years. And finally, Virenbhai, whose loving seed and intention to serve over the past 30 plus years has sprouted into what we now know as Manav Sadhna. So I'll invite Virenbhai to now just give a little backdrop on Manav Sadhna's COVID relief work over the past year. Thank you.
So namaste, and again, thank you very much for joining us in this Zoom call today. Those who don't know and not close to Manav Sadhna, just want to briefly tell you that it's an organization runs from Gandhi Ashram, and we're doing this for 30 years. Very deep-rooted grassroots serving the urban communities of Ahmedabad. So we reach out to almost 15,000 people daily. And when I say reach out, we serve them with education, well, love, of course, first, nutrition, health, sanitation, empowering women, youth, all those beautiful things. Just a very holistic way of empowering those communities. But anytime when there's a natural disaster hit, when there's issues out there by nature, for example, earthquake in 2002 in Kutch, we ended up living there for 6 months and completely rehabbing a village. When tsunami hit in South India, we were there. In Himalaya, when the landslide and the flood was there, we ended up going there and serving the best we can. Similarly in Nepal, after earthquake, we were there. And sure enough, since last year, this COVID hit in India. So on 26th of March, 2020, is where Prime Minister of India declared a complete lockdown of India for almost a month. And that day, immediately, our first thought was, how are people going to feed their family? Because there's 35% of the people just in our city earn every day and feed their family, they earn daily. So immediately the first response was we started doing grocery kits for the city. And we continue that and to grow and into going into the different slums and different communities. We partnered, we network with different people. And by doing that, we created a beautiful network of 48 slum community and distributed about 32,000 kits back then. And after doing that, we continue with the awareness. We also work with the people from out of state who were fleeing back to their homes, and they were homeless for a while. They didn't have food, transportation. So we started helping them too. And then we got a little break. The whole world got a little break. And then 4 weeks, about 4 weeks before we had this terrible, terrible surge of COVID in India, especially just about whole India, but like Gujarat and Maharashtra, it hit pretty hard. And it was bad. It was overwhelming. Even the government didn't know what to do because it was that bad. The infection was spreading so fast in young people, in kids, everywhere. No beds in the hospital. There were lines of outside the hospital. People were really struggling to get oxygen. So many people were out of oxygen. People died right after on the street waiting to get into the hospital. We had, and you probably saw some of those footages. I mean, it was very well published everywhere in TV and everything, but even cremation center, there were like huge lines in all cremation center. There was a waiting period of 6 hours just to cremate their loved ones. And it was really, really sad situation. And right after that, we got together and we said that we're gonna jump in and start serving. And it wasn't easy because it's a challenging time for ourselves and our karyakartas, also putting the risk and trying to see what we could do without getting infected. So first thing we started making kits. Again, food was the issue because it was a lockdown. So we started making kits. Next thing we realized that the folks in the poor community do not have any access to hospital, and they don't even go to the hospital. They try to stick it out with no doctor, no medicine, and some deaths, no oxygen. So we bought several concentrators, and getting the oxygen concentrator was such a mess. I mean, it was just every single concentrator was taken, and we had to get in the black. There's so many people, even in the screen right in front of me, where people were trying to get oxygen concentrator to us so that we can save some lives. But we ended up getting 18 of them, and we were loaning every one of them. And later on, Vandali will share a little bit more about it. But we got that going, and then we got kids going. We got medical van. We started reaching out to the homes in the slums where people is down with COVID. The poor guys don't even know what to do, what medicine to take, how to measure oxygen, nothing. So we hired 2 doctors, and we created this van going to community. And we literally saved a lot of lives. It was a very powerful thing, and it's still going right now with that thing. And so we continue all of that effort and started reaching out to so many people during that time. And then later on, we also started lately, last couple of weeks, we realized the villages, as the Ahmedabad was slowing down, things were getting better. And all of a sudden the villages started spreading up. So now so many villages in India has a lot of problem in a lot of COVID. People don't even know how to deal with it. And similar challenges in villages too. So we started reaching out to villages too. So it's been a very, very intense, but a powerful process for all of us to serve all we can. And we kept evolving and figuring out what next. Like we found out that it's 113 degrees, and the families of all the loved ones who are in the hospital, their families in the hospital, and they're waiting outside all day in the hot sun. So immediate thing was starting serving buttermilk, chas, masala chas amul. So we reached to like 3,000 chas, to like 2,500 chas packet every day. We would have 10 rickshaws going. You will see a video, and it's very, so it was just evolving process for us, and we continue on going with it. And I'm sure all of this process and stuff like that in detail, we're gonna share some things. And next is we got Anju here with us, and she's a pillar of Manav Sadhana. A lot of you know her. She's been with us for 20 years, and she will take from here and show you some of the ongoing stuff.
Namaste. It's so nice to see all of you. And before we get into more detailed sharing, we just want to give all of you an overview of what's been happening over the last 3 weeks. So as you will see in a second, we started around April 27th in a very concrete way with relief efforts in Ahmedabad. And over the course of the 3 weeks, just to highlight a few numbers, we've been able to support 91 lives with oxygen concentrators, care for 175 patients through Karuna on Wheels, which is our medical mobile healthcare program. We've been able to reach out to more than 38,800 families with grocery kits. Something that's not on the screen is that Manav Sadhna works with about 10 communities across Ahmedabad, 10 marginalized communities on a day-to-day basis outside of COVID relief. So in addition to working with those communities in a very targeted way, we've partnered with another 30 or so community leaders and organizations across the city. And together we've been able to reach out to 62 communities where we're promoting awareness and also providing grocery support. And so as Virenbe was sharing, we started off in the city and then the pandemic spread in a very devastating way into the villages. So we extended our relief efforts into rural Gujarat, where again, we've really been working on that power of collaboration. So we have 20 partners on the ground across Gujarat right now. And together we've been able to get support to 503 villages. We have been focusing on 3 core areas, both in city relief and village relief, and that is medical care, grocery support, and awareness. As we're not on the ground in the villages, we can't go serving with our health team. So what we're doing is providing medical kits to our partners who then have their own volunteer team or work with the local government health workers in the villages. And as you can see, an example of a medical kit on the screen, each kit consists of about 15 packets of medications, 8 or so medicines and vitamins that are really essential in helping a patient with COVID recover quickly. We have 2 thermoguns, 3 oximeters, face shields, gloves, sanitizers. We add the batteries in there for the oximeters. And the whole idea, and 95 masks. And the idea is that the medicines are for the patients and the rest of the gear is to keep those in the field safe and able to go around and monitor and measure what's going on with each person. And as Neelam will be sharing a little bit later, this was really, really critical in helping mitigate the spread of COVID. Outside of the 503 villages that we're supporting, we've been able to get 4,465 grocery kits out, and we're going to be working with a lot more food support this week in the villages. And overall, I think just like we were sharing, we're trying to, every day we're seeing what the needs are and organically working with those needs and working with as many people as we can to make sure that anybody who needs support is able to get it. So with that, I would like to pass it on to Vandana Didi, who's going to be sharing a little bit more about oxygen support.
Namaste. As the second wave hit us, more and more patients became positive and they started suffering from lack of oxygen. So the immediate solution was to provide them with oxygen. And for that, we needed an oxygen concentrator. So I think this was the first time when most of us heard about an oxygen concentrator. Fortunately, we had one lying at Manav Sadhna and it was put to immediate use. But we started getting calls after call and there were people on the waiting list. They needed it for their condition to stabilize before they reached a medical facility or before their medication, which they were taking at home, started working on them. But we had no concentrators. So we took an immediate decision to just purchase concentrators. A lot of people called overseas, people like you who are on the call, who wanted to offer, but it would take about 2 weeks for the concentrators to reach us. And we needed it right then. So we went into the market, but there was not a single concentrator available. Everything was sold out. We tried across the country, but it was just not available. Then we spoke to the vendors, we pleaded, we aggressively followed up with them. And then we spoke to people who had backups at home for their aged parents, etc. We borrowed from them. There were institutes which were running banks, we borrowed from them. And then there were people who had booked for their families, so they were waiting for their concentrators to arrive. We borrowed from them. And in 3 days, we had over 9 concentrators working round the clock. As soon as we got a call in distress, our team would go with the concentrator, a fresh mask, train the family, get it going, and get that patient stabilized. They would follow up with the patient, and as soon as the patient improved or stabilized and didn't need the oxygen anymore, I mean, it was such a relief when someone was in 75, 80, and you saw the oxygen rise and come above 95. It was really a relief, and every life mattered at that moment. Today, we have over 29 concentrators with us, and they've helped so many men and women, about 91 of them, and 14 of these concentrators are now, because as the condition in the cities improved, we shifted these concentrators to with the local partners in the villages. And it is really a relief when someone calls and there's a distress call and we can offer a concentrator and help them. We are in a position where we don't have to say no to anyone who needs oxygen. Thank you. And I would also like to share at this moment about Raju. He's one of our grassroots level workers in the village, and he will share his experience about how he was supported with a concentrator.
Namaste, myself Raju from Sarsavadi village. Second wave of COVID-19 more dangerous than previous. This time it affects villages. We have 6 positive cases. As human being, my duty is to serve village and possible to help people here. Gauri Ben, a 58-year-old woman, she lost her husband in Corona. She also was critical. Oxygen level was 80. Doctor said she need to be hospitalized. I asked Viren Bhai from Manav Sadhna to provide me oxygen concentrator. We got one. A week of treatment and care, we saved her. She is out of danger. Right now, I'm aware people to take vaccine. It only hope can save people here. Thank you so much, ESI and Manav Sadhna, to provide me support.
So along with all this work, throughout the COVID, getting infected, getting diseases is of course is so challenging and so hard. But the bigger challenge in the city is malnourishment and hunger. So many people in the city are without work and without food, especially children. The reports are saying that by the time this is done, the percentage of malnourishment is going to increase tremendously in India, because the schools are closed where they get midday meal. The Anganwadis preschools are closed where we provide a lot of really nutritious food. And so many people are at work. So providing wholesome grocery kit is one of the big things that we've been doing for a year and a half. First, we distributed in the first phase, we distributed 32,000. This phase is only 4 weeks, and we're almost 43,000 kits we have distributed. That means 43,000 families were able to eat for almost 12 to 15 days. That's 2 meals a day. That's millions of people actually were able to eat. So, and as you can see in the screen, and there's a small video that's going to follow that show you how immense amount of process and things are done. And all this was possible because of people like you supported it. And when we did that, we made sure that the quality and the price and everything was done, and our team was safe and continually supporting each other to make the maximum amount of kits. And it was amazing. I remember that we did the reach out process in the kits where a man standing in the corner with a pedal rickshaw trying to get some work, and he was locked down, and he was hoping he gets some. Pedal rickshaw is like a pedal cart on a cycle. When we reached him and handed out a kit to him, he had tears in his eyes. He said, I've been waiting since morning, trying to make a little bit of money so I can feed my kids because they haven't eaten since yesterday. Incidents like that left and right. So we haven't looked back. Distributing food and kits has just been so powerful, and we got so good at it. In a year and a half, we are professional making kits. We got people just we can make kits so fast like assembly line. So it's been a fantastic process. Maybe Nemo can show you a little video or the slides of that process of making kits.
Namaste, my name is Ajay. I like to share about Karuna on Wheels. You can call mobile medical van. In Ahmedabad, COVID second wave situation was hopeless. In hospital, there were no beds for patients, and ambulance were waiting in line for hours and hours. In response to the situation, Manav Sadhna started project called Karuna on Wheel. When cases was rising, home isolation only the solution for the COVID patient because hospital were full. There is no bed any hospital. In this underprivileged community, they can afford to go to the private hospitals, as everyone know, because they don't afford. They easily only like survive for 2-time meal. They work for like 10 hours, 12 hours a day. In Manav Sadhna, we started this Karuna on Wheels. In this Karuna on Wheels, we have a team of nurse, health worker, and under doctor supervision. For every patient, Karuna on Wheels, to online doctor consultation, checkup, temperature, oxygen level, doctor take patient history, give medication, and to the follow-up until the patient recover. They organize for the blood testing and provide oxygen concentrator if patient requirement, and also concern the family and comfort them. Our team offer grocery kit, food, fruit, financial support if family require. So far, Karuna on Wheels, we treated 175 patient. 175 patient. Karuna on Wheels has provided care support in this critical situation to the underprivileged community, and it was a blessing for the underprivileged community, because as you know, you heard so many news, ambulance online, no beds, and as private hospitals they charge over and over. Like, so I like to introduce Anjali Ben. She will share about awareness. Namaste.
Thank you, Ajay. And so I'm going to share a little bit about our awareness campaign. The oxygen concentrators and the medical mobile care is really about treatment. The awareness campaign for us is about spreading more awareness and looking towards more preventative measures now and going forward. Due to a combination of a lot of reasons, illiteracy, social conditioning, stigma, culture, fake news, a lot of fake news on WhatsApp that's circulating, and just myths and misconceptions. There's a lot of wrong understanding around COVID. And this is the case in both underserved urban communities and rural Gujarat. So we've designed an awareness campaign that's focusing on 3 levels of messaging. The first level is safety, again, promoting the importance of wearing masks, because still a lot of people are a little bit laxed about it. And because it's quite warm here, it's actually hard and can be a bit stifling. So really encouraging that. Social distancing, which is a little bit of a cultural challenge, and keeping, regularly washing hands with soap. The second level of messaging is around treatment. So letting go of fear and of the shame that's often associated with COVID here, and really doing what needs to get done. So, whether that's timely testing or getting proper treatment so that, families can prevent the spread and also avoid complications that are coming up otherwise. The third level of messaging is around vaccination. I think just like around around the world right now, there's a lot of different ideas of what it means to get vaccinated, a lot of fear around it. So we're really working to encourage people to get vaccinated and to sort of combat all the wrong information that's out there. And we're doing this through several different mediums. One is banners that we're putting up in public spaces in both the cities and the villages. 2 is posters. We've partnered with about 650 rickshaws in the city, and they put posters on their rickshaws, really promoting this same awareness. And we've printed a bunch of flyers that we're packing in each grocery kit. And a lot of people in the villages are passing them out home to home or keeping them outside health camps and creating more awareness as people are passing through. At a more local level, Manav Sadhna has done a few things to really get the message across to our communities. We've done recordings that we're sending out to our students and encouraging them to educate their families about the different things that they can be doing in regards to COVID. And this week, because things have really stabilized in Ahmedabad and it's much better, we're going to start a little bit more of a proactive community approach using folk music with messaging about COVID safety and treatment and vaccinations, sort of intermittently put in with audio recordings about different things to keep in mind. And so that's something that we're looking forward to this week. And this is going to be an ongoing effort because we all know that, to get India vaccinated, it's going to take a lot of awareness and a lot of encouragement. And this is so important also in the case of a possible 3rd wave or another pandemic. This information will really be super useful in preventing sort of the situation that we were in these last 3 weeks. So our awareness campaign, the oxygen support, Karuna on Wheels, and our grocery distribution are very concrete projects that we've been working on in Ahmedabad. But in addition to that, it's been a challenging month. There's been a lot of fear and uncertainty. And if there was ever a time where that touch of humanity was required, it's now. So we have a few programs that we've clubbed under Compassion in Action. And the main purpose behind all of these relief efforts that I'm about to share about is really just to offer a gesture of love and support. in a time where it's easy to feel alone and sort of unsure of what's coming next. So Virenbhai had shared earlier about our buttermilk distribution because of the rising mercury in Ahmedabad and just the people that are waiting outside of hospitals and cremation grounds. So we have a video to share to show a little bit about that. So something else that we've been doing is a little bit of financial assistance, and it's on a case-by-case basis, and largely with families that we've already been connected with over the years in our different communities, because there are different situations that are arising. You know, the main breadwinner of the family passed due to COVID. People have had to admit their loved ones into private hospitals because there were no spaces in the public hospitals, and now they have bills that they can't possibly cover. Also, a lot of livelihood has been impacted. So, you know, for example, we have a young man who does a lot of work in one of the communities, and his family strings flowers and sells them outside of temples. But for the last month, nobody's been going to the temple, so they have no means of earning. So in these cases, we're providing a little bit of financial assistance to really just help them through this phase of difficulty. And finally, there are some really inspiring things that have come up. So one thing we've been able to do is serve 200 warm meals every day to families across 3 communities, because a local volunteer named Mihir was ready to launch his restaurant when the surge hit. And so since he knew he couldn't open the restaurant, he decided to use the team that he had, the setup that he had, and to donate out of his own pockets the ingredients to cook nourishing Gujarati meals for people who've been affected by COVID. So it's for those who are either sick with COVID, family members who are busy taking care of them, frontline workers who really don't have time to care for themselves, and anybody else who really can just use the support. So like Mihir's story, there have been so many countless stories that have unfolded over this month and these last 2 years that really just show the power of generosity and kindness and make all the difference. So now Neelam is going to be sharing more about our village relief. But before she begins, we're just going to show you guys a clip of the Manav Sadhna team hard at work preparing and packing all the supplies that we've been sending into the villages.
So thank you everyone for listening us for so long and your interest. You will be happy to hear that in the city of Ahmedabad, the situation is getting better and the cases are decreasing. But the second surge of COVID has been worst in the villages. And when the situation got critical in the villages, people who were connected with Manav Sadhna, they started calling us for support. By interacting with them, we learned that in the villages, in the week, and the death got so high from 2 to 3 into 60 to 70. So there are several reasons behind this situation in the villages. Lack of infrastructures, lack of health facilities, lack of awareness and misconceptions, and also lack of isolation centers. And as you know that in the interior villages also people are living in these small houses. So if one person is getting COVID, then it's automatically spreading in the families and to the others as well. So joining hands with local village leaders and collaborating with very well reputed NGOs, we provide support in the villages for grocery kits, for medical kits, and for awareness materials. And to provide this support for especially for medical kits, we got help from medical professionals to make ready these kits. And this kits, our team is putting stickers in local languages in each medicine, so our village people know how and when to use these medicines. So this kit includes thermal guns, oximeters, face shields, hand sanitizers, face gloves, hand gloves, and many more, even N95. Some of the villages we have provided support for PPE kits and COVID testing kits and oxygen concentrators as well. And so we are very grateful that all these 20 of these partners and this NGO and entire team, with the support of these teams, we have been able to reach to 500 plus villages in 2 weeks, and we are planning to help more and more villages. The population of villages is also very diverse, and the villages which we are supporting are farmers, are salt pan workers, are tribals, and also artisans families. So out of 20 of our partners, here we are going to have a glance of 2 of them. One is Chandu Bhai, who's from Sahas Foundation, and one is Jabin Ben, who's from Sahaj Foundation. So please have a look at the video.
મારું નામ ચંદુભાઈ ભાલિયા છે. સાહસ ફાઉન્ડેશનનો ચેરપર્સન છું. અમદાવાદ માનવ સાધના તરફથી અનાજ અને કોરોનાની દવાની કીટ આપવામાં આવી હતી. ધોળકા તાલુકાના 25 જેટલા ગામોમાં અમે એનું વિતરણ કર્યું છે. કોરોના મેડિસિનની કીટ વિતરણ માટે અમે આશા વર્કર, સરપંચ, તલાટી અને તાલુકા વિકાસ અધિકારીનો સંપર્ક સાધ્યો હતો અને તાલુકા વિકાસ અધિકારીનો સારો એવો સપોર્ટ મળી ગયો. તલાટી ગામ લેવલે અને સરપંચશ્રી પણ સારો એવો સપોર્ટ કરે છે. ગામમાં ઘણા ગરીબ લોકો છે જેને અનાજની કીટ પણ અમે વિતરણ કરી છે. સાથે સાથે માસ્ક, સેનિટાઈઝર, ઓક્સિજન મીટર, ઘણ, જેનાથી ગામ લોકોને આશા વર્કર જ્યારે ફળિયામાં મુલાકાતે જાય તો એ માપી શકે. આ બધા સાધનો સૌથી વધારે ફાળો માનવ સાધના અમદાવાદ તરફથી છે, જેમને અમને આ બધું વસ્તુ પહોંચાડી છે અને અમે આ ગામ લોકો સુધી પહોંચાડો છે.
Hello, I'm Jabin and I'm working in the tribal areas of Dahod district. Name of my organization is Sahaj and I'm operating it for last 31 years. I'm associate with 5,000 tribal families and my major work is on livelihood. In this difficult time of Corona, tribal are facing so many problems. First of all, they do not have a understanding of the Corona. They do not understand and they do not give timely treatment to the patient. So the oxygen concentrator, testing kit and medical kits given by Manav Sadhna is a great help to them. Most of the time they come to the hospital or doctor at last moment when they are losing a person, and at that time oxygen concentrators are lifesaver to them. So I'm really thankful to Manav Sadhna and the partner of the Manav Sadhna. Thank you so much.
So every single day we get phone calls from different villages, and we are still planning to support them for next some weeks. Now Virendra will share about finances and also next steps of Project Karuna-Phase 3.
So namaste again. We're almost there. Where like Nemo shared, the purpose of this Zoom call that we invited you all is to share with you that all the loving donations and support that you guys gave, how is it being utilized so far, and how beautiful it is, and compassionate support is working and helping so many people. Intention is not to just raise more funds. We want to share with you and we want to thank you. As you will see in the slide that Nemo will put up, is you'll see how much money going where, basically, because we also like to be very transparent in how we do it, what we do things. So far, as you can see in the 5-6 different categories that we showed you, the maximum amount of money has gone into the medicine and groceries, of course, and we have spent about 2.10 crore rupees. So that's about $300,000 that is already spent. And we are continuing that. And in next 2 to 3 weeks, like Neelam was saying, we're constantly getting phone calls. We're gonna support another 400 to 500 villages, I'm pretty sure, before this is over in next 2 to 3 weeks. So we'll continue that. And I like to share with you that when we use the money, when we spend the money, every penny is been very carefully spent. For example, oximeter on a retail, you can buy it for 1,500 rupees. On a normal wholesale, maybe 900 to 1,200 rupees. We got it for 750. And then we put some another team ladies, and they went and worked on the guy more. We got a great bargainer, so we got 700 rupees. Same with rice and wheat flour. Normally it costs 30 to 28 to 30 rupees. Our wheat and rice comes at around 22 to 24 rupees. And it sounds like 5-6 rupees, but so far we already distributed 150,000 kilos of rice. 150,000 kilos, rice times 5 rupees is a lot of money. So my point is, we try to make sure that every penny is spent well, and your money that you give us with so much love and faith is used properly. And all the entire team is trained and ready to do that. Now, another important aspect that I want to share about the finances, many NGO wanted to do this, what we are doing actually. But unfortunately, they didn't, the FCRA rules and protocols has been so tough. Without criticizing anything, is just horrible. Many of the NGOs can't even begin to start serving, even though people like you want to help them, they can't start because they don't have the money. Fortunately, from phase 1 and 2, we had some money left over. So we immediately launched everything, most of the stuff. And while we were doing it, our team in the screen that you see, some of them started working, and we started raising more funds, and we started doing it. But again, the protocol is so hard. Some of the money that's donated, it's coming, it's in a pipeline, but a lot of it is still not in our hands. So what we did is, for a year and a half, all we are doing is Corona, our 110 employees. So the existing projects are on standstill, kind of. Most of them are. So we are able to use that surplus fund into the Corona, knowing that the money is in a pipeline, we're gonna get it. Because this is something we didn't want to wait. This is something, it's medicine, it's life, it's oxygen concentrated. How can you just say, we're gonna wait? We have some money from whatever money we got, we started spending. So here we are, we like I say, we spent about $300,000. We're gonna be expecting, like I say, 400 to 500 more villages, and we'll be supporting and spending more money there. By the time we're done, I think it's going to be 100,000 kits, maybe more, that we're going to be sending out. At the same time, the impact of whatever we have done is so powerful. And we are able to do this. All of this that you saw on the screen was made possible because people like you. So we really appreciate it. Our team. Here's our team. I'm sure some are still missing. We got about 110 of amazing people. They all are at work. They all know the risk, but they're safe. They're healthy. They're taking care of themselves. And it's amazing. So a lot of times we tell them, and it's voluntary. We tell them, if you want to stay home, it's okay, we understand. But none of them are. They all want to be out there. They're like soldiers. Really, I call them a soldier. Soldier on a war against Corona to save lives. That's what this group of people are doing. And they're doing it every day. And with you supporting and this team serving every day, we're helping lots and lots of people. We're saving lives. So we want to thank you. Thank you very much.
Thank you, Rinbay. Thank you to all of our Manav Sadhna staff, team, and family for sharing today on behalf of the bigger family and on behalf of all of you. Thank you all for joining in the spirit of learning together and working together. I think, like Virenbhai mentioned, this call's intention is to share so we all can feel more connected to the work. We are not raising funds. Virenbhai mentioned we have enough funds for the next phase of our work, so we're not trying to raise more funds right now. So we really want to just appreciate all the beautiful support that has been going on. And I just wanted to invite the next few minutes to allow for anybody to share or ask any questions. Again, this is a learning journey for all of us. If there's any questions or any thoughts, feel free to either raise your hand or just because it's kind of the mute is, we have to unmute you. So just you can raise your hand or put the icon up to raise your hand if you feel like sharing anything or asking a question to any of our team members. Yeah, Himanshu bhai, ek minute.
Hi. First of all, thanks for taking the time to share all this information with us. And needless to say, we admire immensely all the good work that you do. We feel very humble that we can support you in a small way. Couple of questions. First, we obviously read a lot about what is going on in India in the US press. It will be helpful to kind of get your view, people who are on the ground there. So if a poor person is sick and needs to be hospitalized in Ahmedabad, can he get a bed in the city now? Are the beds available?
Yes, now they are, Himanshu. Now they're available.
What about availability of oxygen in the hospitals? Do the hospitals have enough oxygen supplies now?
And I think one of the things about Manav Sadhna that just I think I'm really appreciating is the comprehensive and in-depth nature of how you guys are covering the services, from education as well as groceries. And yeah, I think I just continue to be really, really impressed. And the quick question I have is this call recording going to be available to share with friends? Because I think it demonstrates really well the kind of really wide depth in which Manav Sadhna goes to offer services. So yeah, just that's the only quick question for right now.
Yes, Ashwin, we're gonna have the video link available to share for sure.
Thanks. Thank you.
Thank you.
Okay, Nina Ben.
Hello. Thank you very much, Nimesh, and all of you. You've been doing excellent work. I have a couple of questions. One is we are in a process of working with 2 or 3 hospitals to put in oxygen plants. So what do you think? Do you think it is useful, seeing that the cases are going down in cities and there's no oxygen shortage? So I would like your perspective on it. And the other thing is, oh, go ahead. Yeah.
No, please go ahead. Please go ahead.
Yeah, and the other thing we were doing is we have cancer clinics in Ahmedabad and other places. So we are going to get some vaccines every day, and of course that is for we have to pay for it in that way. But we are ready to kind of give part of those every day to people who really need it and cannot afford it. So I was wondering if Manav Sadhna could help us coordinate that.
Both answers are yes, actually. Okay. Putting oxygen plant is an excellent idea. I think it's a beautiful thing. They are talking about third wave. I hope it doesn't happen. I hope the medicine scientists are wrong, but who knows? If that happens, we're gonna need that plant. People are gonna use it. And the second part is awesome. If you, we would love to be involved, and even our own family Manav Sadhna groups. We still are out there looking for vaccination. Yeah.
Okay, great. So we'll have someone contact Manav Sadhna. I think we have been in contact anyway. So once we start getting the vaccines, we'll let you know and see how we can coordinate that.
You have any Nanaben, I know someone in Ahmedabad, a company which is setting up oxygen plants. So I could connect you to your team, to that person. It's a full company, and they've already set it up for 2 hospitals. So I will be able to connect you. They're technical.
Okay, great. Thank you.
So just one question. This is Ravi Patel. I just had a question. Did you say that the oxygen plants are, the requirement for them is decreasing, or are you saying that they will still be necessary? Because, if you put in 2 or 3, it is a little expensive. And if it's not needed, we can use those resources for other things. But according to what you're saying, they're just as equally important right now, even though the cases are going down.
I think it is important because I think the way they're talking, they're very certain that there's going to be a third wave of COVID coming in. And if that happens, again, we're going to be in the same situation. And in that case, if we have plants like this and pre-prepared, I think we'll be much better off. So I think it's a good investment.
And also the last question is, do you have any suggestions of hospitals that are prime, that really need that oxygen?
So actually the friend whom I'm connecting you to, they're doing exactly this, and they've listed out who has it, and there are different capacities of the oxygen plants which can be set up for each hospital and the requirements. So they would be able to really answer all your questions.
Oh, that's very good. Thank you.
And the other thing is also, from what I learned from them, that this is one of the purest and the best way to get oxygen, more than concentrators or cylinders, setting up plants outside the hospital. That is what they were saying.
Okay, great. That is good. So I think Nimish has my email address, so we can connect that way. Yeah. Okay, thank you so much. And thanks for doing this great work.
Yeah. Thanks again for doing this great work. It's phenomenal. Thank you so much.
Thank you, Ravinder. We'll have Laura. Oh, I think she... Oh, there you are.
Aloha, namaste, family, Manav Sadhna. It's wonderful to see you all and to hear you all and to see the videos and photos of the ongoing amazing work. It's the work that you've been doing for so many decades, well, for a few decades now, but shifted to the next higher gear, of course. Not just Manav Sadhna, but I've also been seeing the wonderful work Vandana Didi has been doing with the Dreams Foundation. Just incredible. Nemo, I know that there's a link to online GoFundMe or some type of fundraising effort that's online. Could you post that in the chat?
Sure.
Here in the United States, the California state has been the worst impacted, surpassing New York. And in the city that I live in Southern California, it's the worst impacted in our county next to LA. And so we've been serving 3 to 4 meal distributions kits like what Manav Sadhna is doing, and just serving over 2,000 per month. And all of this inspiration has come from Manav Sadhna and many other amazing organizations doing the same service of love and compassion for our global family. And so I just want to bow down and humbly express my deep gratitude and love for all of you, for the inspiring selfless service that you do from the Gandhi ashram and beyond to all the villages. And we will definitely be shifting some gears here as vaccinations have ramped up and people are doing better and getting back to work. And so we will definitely be promoting to help support the efforts there with our family in Ahmedabad. But again, thank you so much. Nemo, can you and I please be in touch very soon? And well done. And we love and miss you all. And hopefully everything, God willing, will be back to a better normal.
Thank you, Laura Mom. We have the Shah family.
Yeah, thank you very much. And thanks for doing this kindly, wonderful work. It's really commendable. My question is that as you were saying that things are becoming better and it has spread to villages where your action has also now gone into the villages. So at this stage, what kind of support you need either in case or kind, that could you please elaborate?
I think either way is good. I mean, if somebody wants to supply us with medicine, medical supplies that we need, or the groceries, we'd love to take it in kind. It's easier for us that way. And if somebody wants to, somebody's donating, then we're going to continue spending it on those items. But those are the two big items: medical supplies and grocery kits. Basically, is the main things that we will be using for.
Thank you. Anybody else have any questions or want to share anything from their experiences? And definitely want to be mindful of the time. Anybody has to leave, obviously, can exit. But
Nemo Hasmukh uncle has a question.
Hashmukh has a question.
Okay, Hasmukh uncle, if you can.
I'm joining you from Leicester in England. And just to let you know, guys, that Leicester Mercury, which is the local paper here, carried an article about Manav Sadhna and the wonderful work you do and your connection with De Montfort University in Leicester. So well done. And that connection and my reading that article got me in touch. I made a small donation to you guys through Cato platform. But my colleague in Lions Club, Dr. Shah, Dr. Dilip Shah, got in touch with one of you guys, and he forwarded me the email with today's Zoom meeting. So wonderful. It was nice to join you all, and I say keep up the good work, and possibly we'll be able to, through our Lions Club and through Dr. Shah, maybe we'll be able to do more for you. Thank you.
Thank you, Hasmukh bhai.
Thank you.
Thank you.
Jainesh bhai has a question.
Hi, everyone. Manav Sadhna family. First of all, just so relieved and happy to see that you guys are safe. So have always been worried about you because we get information about all the work you do. And obviously just awesome. You guys are doing great, like everybody has said, but just it's amazing the coordination and the multi-pronged approach that you have taken. So two questions. Did you guys run into any supply chain issues? Because that's what I'm hearing a lot. I know you are doing a lot, medical kits, grocery kits, but are you able to just procure everything that you need, or do you have issues with that? And then my second question is, of course, safety. I know I saw people wearing masks and face shields, and what percent of the Manav Sadhna family is vaccinated? And going forward, do you feel that there is any danger to the safety of your volunteers?
Yeah, those are all very, very, very good, powerful questions. Procurement of the things were a little bit tougher in the beginning when the lockdown was there. And then the prices went up, especially the concentrator was tough to get, even the groceries. But then after that, people realized what we're trying to do, and we were able to get the wholesalers, just like actual mill, like rice mills and flour mills. That's what we got connected with. And we started truckloads coming in. So those kind of stuff made things easier for us, the procurement of that supply. Same thing in the medical supplies. We were able to get the main wholesaler, a supplier who's supplying the wholesale. So we cut all the costs, and we also get enough material on there. I really don't have exact number on how many people got both vaccination. I know I do. And I would say about 10% of the people in MS has two vaccination. And one of the reasons why is just we can't get it. We want people to get second vaccine. Everybody's got the first one. The second one, there's people waiting for it. So we are extremely careful. Our distance and stuff. So far, 4 people, I think 4 or 5 of our team member has got infection out of 110, and thank God they were out of it very quickly. No more than 6, 7, 8 days, they were okay. And we are trying very hard to be careful. Of course, we want to serve, but we want to make sure our team is safe and be able to work. And I think I also feel, and it's kind of, I don't know how to say this, but I think we also have this really faith in the system. Well, I mean, guy my age been serving almost a year and a half, and I'm out there exposed. I'm trying to be safe, but it's still, I'm in slums, I'm there in villages, all of us, and we are somehow protected. So far, so good. So we also have to have a little bit of faith there and continue working. So, but yes, we're gonna make sure we get more vaccination. And thank you, Mamta Bhabi, for checking on us and caring about us. We appreciate it.
Remember, she wants to come there as soon as possible so she can be part of the team.
She's welcome.
I have one question, maybe for you and Anjali. Would like to know a little bit more about the livelihood challenge, like what, as people are coming out of it, I'm getting news about orphans, a lot of either, like Anjali said, the earning member of the family is gone because of COVID, or both the parents are gone and their kids who need support. So is there a plan? I mean, how are we, do you see a lot of that? And if so, any thoughts you have on how to help with the livelihood issues of a lot of the people that you touch? If you have some thoughts, you can share.
So Janish, this is actually a good question for Vandana Didi, because she's been sharing a lot of the calls that are coming through, and exactly this scenario of women who have lost their husbands and are struggling to find work. So I think, Didi, if you want to expand on that.
So Jainesh bhai, just to let you know that this is a very, very important concern, because right now we are deep into relief, but ultimately we need to work towards rehabilitation of such families. And it's easier in villages, because when I'm talking to families in villages, there are, especially if the women is left behind and the main breadwinner has gone, they're agreeing to get a cow or a buffalo or small simple businesses by which they can earn and sustain their families. But in cities, for a woman who's say fourth class pass or not educated, it's been very, very challenging to get them into a job and search for something where they can sustain. Because the groceries we'll give for a month, 2 months, 3 months, but ultimately they have to stand on their own feet. What is good is a lot of organizations and schools are coming forward and offering, okay, we will help educate their children. When we are approaching people, please find a job. Like I was speaking to, it's not only people from the underserved community, even low middle income groups. There was a girl who was an architect in Indore, and she says, look, we have no food in our house, and I don't want to beg people for food. Can you get me a job somewhere? So we got her a job. We got a job for a security person in Nadiyad. So people are working and they're sensitive towards it. And it's easier for people whose requirements are less. So for the people who are really underserved, getting 2 square meals is going to be a challenge if they've lost their livelihood. But we have started working towards it.
And Janesh, this is something where is going to be a very important task for us as we go forward. Right now, the priority is still taking care of the villages with medical supplies and food and kits like that. But we know that our next work over for next couple of years or so, we'll be finding people who lost their loved ones and earning members in the family and see how we can support them with dignity. So that's something is going to happen. And we hope and we kind of feel and hope that we are going to have some leftover funding, because we are raising beautiful support, and people are humble and kind. So we're raising good amount of fund. So whatever is the leftover is going to be spending. We're going to be spending a lot towards supporting those kind of families, for sure.
Okay, I think we should start. If we need to start raising for that, plan.
Sure.
Plan.
Thank you, Jainesh Bhai Mantavi. So if anybody else still feels wanting to share. Otherwise, we thank everyone for spending this time with us. It's really beautiful to see this circle. I mean, everyone in America or the UK or France or Australia, many times you hear saying we feel so disconnected from all this. But please know you're deeply connected to it. It's such a beautiful circle of giving and receiving, and everybody is a part of it. So on behalf of Manav Sadhna, we want to thank all of you for allowing this relief work to unfold, and for the constant prayer, obviously, that things keep healing, getting better, and that people are out of their suffering. So we'll end with a minute of silence. And we'll just share again the same bell so that we can all take this collective energy and send it as prayers to those in need. So thank you all again. We love you, and we'll just end with a minute of silence and then song Vasudeva Kutumbakam, which means the world is one family. Thank you.